So I'm going to start by saying hi, everyone. We are recording this session of the SCARP meeting. It is the February 2021 SCARP meeting. And so we are setting up the record function, hopefully to be able to offer up our meeting to whomever can't make it. We'll probably be posting on our Facebook page. So make sure you follow us on Facebook. And we will look at other avenues as well. So just to give you a quick lay of the land, we're going to kind of pick and choose as we go around like we usually do. Somebody will get us started, give us their updates from their agency, and then hand it off to whomever you want to hand it off to next until we make it all the way around and get everybody's input. Um, and we look forward to hearing what you have to say. So, Rob, do you want to get us started?
Sure. Rob Rogers, I'm the Director of Substance Use Prevention and Grant Services at Kennebec Behavioral Health. Also am the Director of the Respect Me program, which is a certified batterers intervention program for female offenders. Teach that class with Michelle. We currently have 3 class offerings, one in Skowhegan, Waterville, and Augusta. Some of the things we have coming up, Skylar won't be here today. She's on vacation. So she would want me to just let people know that she continues to have the SERP and Prime for Life offerings for both adolescents and adults. That's an educational program that helps people that may be pre-contemplative in their use of substances to either prepare to enter treatment, or if they're engaging in some what they may call high-risk use but do not have a substance use disorder, it can actually deter them from progressing along in their use and go back to making some lower risk choices related to the use of substances. The program's 12 hours long, but it's currently being done virtually, and we're able to get those classes done in about 10 hours at this point. So we typically do 5 2-hour sessions is what it is. CRAFT, which is a evidence-based treatment modality for affected others, is taking place in all of our locations, but specifically we have a CRAFT group in Skowhegan that's being run by Kathy Soden. She now has 6 people that are actively attending those groups. It is set up with open enrollment and no termination date for that program. So if you do have people that are interested, location is not a barrier at this point because it is being conducted over televideo, so they can really reside anywhere. They do need to become a patient of KBH, even if it's just for that group aspect. So they may get services from somewhere else, but we would, if they're not already in our system, we would need to complete an intake with them so Kathy could bill for those appointments. We're getting ready to do some hotspot mapping and focus groups, specifically looking to do this with groups of youth and also with groups of adults or community members. And we're really looking at where do youth and adults identify as potential problem areas, but then also trying to take a positive spin on it. Where are the places that they feel safe, that they feel connected, and to be able to build on those opportunities within the community. It's a way of getting a snapshot of what are some of the things that we can do in our communities to reduce substance use rates among adolescents. We're working on formulating those questions. We're looking at, because it would be done via Zoom, probably no more than an hour to conduct this. So we're trying to be very selective in the questions that we ask. But what I would ask all of you is, if you do have groups of either youth or adults that are sort of captive audiences that would be interested in doing some of this work, reach out to me and I'll be trying to schedule those focus groups. And then the last thing for this month is I did get approached by one of our clubhouses. So I'm putting together a brief presentation that's going to be designed more as a group discussion, specifically looking at the use of cannabis and the impact on employment. The clubhouse members have questions as far as, or misunderstanding, well, it's legal in Maine, so I can use and I can go to work. And part of Clubhouse is, building employment skills. So we're going to have a dialogue on what does it actually state in the rules and regulations for both the medical marijuana program, but then also the adult use, and how some of that does sound vague. And then what do they think that means? And, what's it mean to be impaired and be at work, and how your boss is not obligated to make accommodations for you to use while you're at work, and some of the things that are spelled out. So if that's something that you have groups that are interested in, that is a presentation I'm working on right now. I think that's it for me, Julie.
Who would you like to pass it off
Oh,
to?
Dana's right beside me, so go Dana.
Here I be. Not much news to report. We still have COVID money. So for people who are, income eligible and affected directly by COVID, loss of wages, still can't go back to work because of, being quarantined, whatever it may be. They need to give us a call. We may be able to help with whatever. If they are behind on their electric bill, we ask them to call CMP first before they call us and talk about, work with the payment plan. And this time of year, if they need further help with that, they would call our water bill office and talk to the LIHEAP folks, because that goes through them. Some of the other things we do ask, if they're behind on certain bills, one of the first questions is, have you talked to your mortgage company, your, wherever you have your car loan or whatever, to see if there's other arrangements that can be made. So it isn't automatic, oh, you're behind on that? Sure, we'll pay that, no problem. They have to do a little bit of homework first. And then they're asking for a lot more documentation now. So they, we have to see, they either sign an affidavit saying I have had no income for the past 30 days, or we have to, hold on just a second, or we have to, have a copy of their unemployment stubs, or, that readout, whatever it may be anyway. But we still do. Our other funding is kind of in purgatory right now. It's kind of on hold until we figure out with the feds and everybody exactly how that's to be used. So mainly it's the COVID money at this point. And that, I think that's pretty much it. I mean, if people, certainly if people haven't called in for or gone online to do a HEAP appointment, they should. And the rent for people affected by COVID that need help with their rent, that application is also online at our website at kvcap.org. So they can apply there too, because we process those for Somerset and Kennebec counties. So, and that's really about it. So I'm going to go to my right, left, whatever, to Rita. She's the next one.
Okay, on my screen, I'm on top, in the middle. I'm representing Hospice, and just update from last month is that we continue to have an active equipment sharing program: hospital bed, walkers, wheelchairs, portable commodes, shower chairs, depends, and more. All equipment is free to the community, so all you have to do is call and ask, and we have a list available, and they can come right over and take a look. Amy continues to provide grief counseling, and this program is growing every day. No groups at this time. so it's one-on-one or over the phone. And the other thing we have a reminder of, hospice does have a pet peace of mind program. The person has to be on hospice in order to have this particular program, be involved in this program. And that involves pet care, pet visits, and whatever the patient needs for their pet. So that's all we have for this month. Thank you. And I'll pass it over to Jessica.
Perfect, thank you. Good morning. Jessica Willett from Northern Lights Tabasco Valley Hospital. I am the data implementation coordinator and project coordinator on 3 different substance use grants. Some of the things we have going on right now, we have a movie, so Onward, we're hosting that virtually, so it's free. So if anybody wants to have access to that, they just gotta go find Healthy SB Facebook page and pre-register, and then I'll just send out the access code. We're also hosting a family dinner with KV CAP and the Greater Pittsfield Area Kiwanis Club on Thursday, February 26th at the Elks Club in Pittsfield, and that's from 5 to 6. So call ahead and register for that one as well, so we have your meals ready for you when you show up. And you can call KV CAP, Kristen Plummer, and it's 859-2520. And then we have Mr. Sean Presents. We have a Rodney Orama presentation on March 23rd at 6 o'clock, and that's virtual. And if you could just register for that as well, you can find that on the Healthy SV page, or you can find it on Mr. Sean Presents Facebook page. And it's going to be a night of read aloud, joke making, and Rodney's going to teach you how to draw. And Rodney's a puppet, so it'll be really, really fun. And just pre-register so we can send you all the drawing supplies that you guys would need. I think that is it for me. Thank you. I will go ahead and pass it off to Deb.
Good morning, I'm Deb Casey. I'm from Somerset Public Health. And Somerset Public Health, we work to improve the health of people who live and work in Somerset County. And we do this by partnering with people like you guys on a number of grant-funded projects with support from the hospital. And my role is the tobacco prevention program community health educator, and I do have a few announcements to my colleagues who couldn't make the call. So I work mostly in multi-unit housing managers and landlords trying to implement or help them strengthen smoke-free and tobacco-free policies in multi-unit housing and behavioral health, healthcare settings, municipalities, and all other environments around the county as an effort to reduce exposure to secondhand smoke. We also work in the area of primary prevention. We have an opening now for a community health educator to work with me on tobacco with more of a youth focus in the schools for primary prevention. And that application is available on the Reddington Fairview General Hospital webpage. So if you know anybody who would be a good tobacco educator, put them in that direction. And with the third area is trying to help people connect with the Maine Quit Link and the 1-800-QUIT-NOW services for tobacco treatment and to get off tobacco. So that's kind of what I do. And I don't know if Cynthia was planning to mention this, but I did get a poster from Betsy, who works on our opiate program. Let's see, Pathways to Recovery, part of the Rural Communities Opiate Response Program. And she has been running virtual Narcan trainings, and her poster is on the Somerset Public Health Facebook page. Her program is called Saving Manny the Mannequin the Narcan Way. And she runs these regularly and periodically, and people get free Narcan sent to them after they complete the course. And Cynthia, you can expand on that if I missed something. Also, Cheryl is one of our areas besides substance use prevention, opiate, addressing the opiate use problem. And is another area we work on is obesity prevention by trying to promote healthy eating and more physical activity. And Cheryl is one of our SNAP educators, and she and Brady run virtual store tours where people can sign up and get a tour around a Hannaford store without leaving home and learning how to stretch their food dollar to buy healthy food and earn a free $10 Hanover gift card for their time and their commitment. And those are running in March on Tuesdays and Thursdays, March 2nd, 4th, 9th, 11th, 23rd, 25th. There's an afternoon session and an early afternoon and a late afternoon session. And the sign up enrollment form is also on our Facebook page. And just wanted to share something that came through my email that maybe some of you have already seen, but there today, actually, from 2 to 4:30, there is using a trauma-informed approach to enhance tobacco cessation webinar. And that came from, that was on a listserv that I signed up for. If anyone's interested, they can email me and I will share that email with them. If anyone's free from 2 to 4:30 and is interested in trauma-informed approach to enhance tobacco cessation, just let me know and I'll share the email with you. And that's kind of what I have for today. And I will pass this to Cynthia so she can correct anything I said wrong.
Oh, thank you so much for those updates, Deb. That sounded great. I'm Cynthia Courier. I'm a patient navigator for substance use disorder. I also work for Somerset Public Health. So I am still doing what I do, getting out into the community and into the offices and meeting with people with a substance use disorder who are looking for some kind of resources or services or connections to the community. So people can call me or email me anytime. I have I don't bill for my services. There are no qualifications. Anybody can reach out to me. Also affected others, trying to connect them with things like craft at KBH and counselors and other services and supports in our community. If anybody knows anybody who would like to connect, they can just give me a call. So I'm also working on some other projects at Somerset Public Health, working on integrating recovery coaches, the volunteer coaches in our area, into the workflow here at Reddington. So hopefully we will soon have a protocol for people who are inpatient with a substance use disorder and want to connect with a recovery coach. We're trying to make that seamless and universal. We are also working with first responders. I've had a lot of requests from first responders for Narcan to have on their trucks and for their team. So we have some options for them. So if there are first responders in Somerset County who would like more information, they can give me a call. And Betsy and I have been giving them options and having conversations about how we can work together in the community. And so Somerset Public Health is looking at running a social media campaign around recovery. We're trying to do it very slowly and very carefully, but we'd really like to bring in people with lived experience with a substance use disorder or tobacco use disorder or mental health diagnosis or anything that they've overcome, even a health diagnosis or health crisis that they were able to overcome and want to share that with our community. Uplifting recovery, sharing messages about treatment that's available. So I've reached out to Jamie, the director of El Rancho de la Vida, the recovery housing, because he's a person who is very open about the fact that he is in recovery and he's very active in our community, helping people find their path to recovery. And so I think he's one individual who will be interested in helping us kick that off. And so I'd like to put it out there, if there's anyone else who is well established in their recovery and is interested and comfortable having their face and maybe a quote shared on social media through Somerset Public Health, please have them give me a call or shoot me an email because we'd love to chat. So I think that's a summary of what I have going on. I think I will pass this off to Michelle.
Okay, thank you. And I'm gonna, share my screen because since we're doing it this way, I would love for people to have all of our information. I'm with the Family Violence Project. We're the Domestic Violence Resource Center serving Kennebec and Somerset. Our offices have been closed since the beginning of the pandemic, but all of our advocacy services are still available over the phone. People can call our helpline anytime to speak with an advocate. We still are doing court advocacy, and we do have advocates going into the court still for people needing protection from abuse orders and wanting support with that. We may be able to go with you, so call our helpline. We do have a virtual support group that's happening. So that's, if you want to be connected with that, again, call our helpline. Our CPS liaison had been on maternity leave, but we're happy to say she's back now. Saray is really helpful with working with people who have open child protective services cases, CPS cases due to domestic violence or due to other things. But if there's domestic violence happening, she can be an advocate with that survivor and sort of be like a middle person, explaining why CPS is doing what they're doing, and also can try to help CPS understand like why a survivor might be doing certain things too, because sometimes it's not always understood what people do for safety. May not make sense from the outside. So if you want to connect with any of our programs, you can call our helpline. We also are going to have a reading group starting up soon, where this is with the Maine Humanities Council, and we provide the book. It's for community partners. So if any of you are interested, we're really excited to have this going. It's one afternoon a month in March, April, May, and June, and it'll be over Zoom, of course. And we'll be reading this book, Things Fall Apart by Chinua Achebe. This is the only book we're reading, which is different from normal. Normally we have a couple books and some poems, but this book has a lot in it to sort of take apart. So we'll just be reading it in sections and discussing those. So yeah, that is all I have. Oh, and we do have an open staff position at our Kennebec shelter. So if people are interested in that, they can apply on our website and follow us on Instagram and all those things. So, and Facebook. And if people need materials, we can send those out to you. You can call our helpline, because that is a thing. We aren't seeing each other in meetings. So if you need materials, our cards, our tear off sheets, you can call our helpline or our main office for that as well. And I will pass it to Dan.
Thanks, everybody. I'm Dan Jenkins. I'm with Congressman Jared Golden's office. I'm always glad to get these updates. It's really good to see all the good work you're all doing. The Congress is working on another COVID relief package that will probably come through in the next, hard to say exactly, but month or so. That will likely provide a lot of resources for nonprofit organizations and other similar, particularly healthcare provider types of things to help with the coronavirus pandemic and the knock-on effects from that. We wait to see exactly what will be in such a bill, but something to keep an eye out for. A standing offer from our office is if any of you or in your nonprofit capacities apply for any federal grants or are thinking about applying for them, feel free to reach out to us. We provide letters of support, and we can do some grant searches if there's a particular project or something along those lines. That you think there might be federal resources available for your organization for. So don't hesitate on that. And we've been doing our best to try to get information out to the public about vaccination sites, about resources that are available for nonprofits, particularly when they're new. So if you happen to be friendly with other folks in the nonprofit arts sectors, there are shuttered venue resources for those kinds of public arts or live event communities that have been basically totally shuttered because of the coronavirus pandemic. We'd hate to see some of our local theaters and local art venues go under. And there are federal resources that are becoming available for that from the last round of coronavirus relief back in December. Don't hesitate to reach out. Our office number is 207-241-6767, or you can email me directly, dan.jenkins@mail.house.gov. Thanks, and I'll pass it on to Tori.
Hi, everyone. I am the intake manager and also the referral line for Maine Behavioral Health Organization. So I pretty much do two different roles at the same time. And so I do all the referrals for the Augusta and Skowhegan office, but we are also expanding, which has been pretty big news for us lately, to two different areas, Bangor and Biddeford. So that will be really big for us coming up. And as always, we're taking referrals for case management, counseling, and medication management in Augusta and Skowhegan locations. And we will be taking referrals for the new locations as well. And my direct line, which I haven't put out there before, which I am, is 485-3313. So anybody can give me a call, and I do all the referrals. Thanks. Who hasn't gone? David?
Good morning. I'm David Dorr. I'm the director of the Somerset Career and Tech Center. Got quite a bit going on, so I'll share that. One of the things that we're doing is what we call a portrait of a grad. And what we need to do is get stakeholder input to help us to come up with a mission statement for the district leadership team for the whole district. The high school is going through an accreditation, and we're part of a bigger, with the Western Maine Education Collaborative. And so what we want to do is really to get a lot of input on what a future graduate of our schools should look like, what traits and skills should they have. And so we're putting together a survey right now, and when it's ready, I'll let you guys know. It's going to be online, asynchronous, so that you can watch it and then take the survey. Right now we're writing a direct services grant through the Gorman Foundation, and that's open up to anybody. You know, I think hopefully I shared that with you guys last month. It opened February 1st. It's due March 1st, and we're writing it particularly for our food pantry. So at the Skowhegan, at the Somerset Career and Tech Center, we have partnered with like the Rotarians, and we work with a lot of different people like the Good Shepherd Food Bank to provide food for all our students. And during the summer, we were putting out about 350 boxes, 375 by the end of the summer, serving about over 700 students. Right now, we're doing weekly backpacks, so about 180 of those per week. We've also got a food pantry right at the school that's, the door is always open, and kids are coming in and filling up boxes and bags. It's a lot different than last year. I think last year they would just meander in and take a few things. This year they're actually being deliberate and taking a grocery bag and filling them up and taking them home regularly. And then if you know somebody who needs something, have them call the school. Steph Fodor or Deb Lancaster will take that information. Chelsea Carrier is also part of what we're doing, and we'll get the information, pack a bag, somebody will deliver it. We are expanding our programming. So we have, we ran out of space in our building. So we're partnering with the Madison Area High School to expand the welding program. We always had, 14 to 18 students on the wait list every year. We met up with Madison, so Crystal Bank gave us space over there, and we're right in the process of renovating that space. It's the old metal shop over there to create a welding program. And we're funding it. It's going to cost us about $300,000 to get this ready. And so far we've already got about 60,000 committed, and we're going out for more. And then I have a grant through the state to help get the equipment. So that's going to expand the programming there. And we're also adding a CDL program. So the thing I think that helps the community is we're not planning to shut the lights off at 2 o'clock, right? When the school's over. We are meeting with like Brad Farron and Tim to see what we can do to have that open in the evenings or on weekends, you know, because we'll have a couple of trucks, we'll have a welding shop, and we've contacted the Hope Project. Sherry Wilkins got a hold of me, and so they have money for that kind of training after school. And then we're meeting with the Region 3 Workforce Development Board to come up with other ways to get kids, people trained, adults trained after we do the students. So a lot going on. If you have any questions, you know where I work.
David, are you guys still repairing cars? I've had questions about that.
Yes, and so this year's been a little interesting, right? Because of the hybrid model, we had to split our schedule up and have like the kids that come on the buses. So the sending schools show up in the morning, they leave at 11, so they have a shortened day. And then Skowhegan comes over in our building for the afternoon session, which leaves less time for the students to work on cars, you know, in a block. So they're not doing as much as they have been. So hopefully next year we'll be back on track. Julie, I think you're last.
Yeah, I think I'm it. Thank you. So I'm Julie Bielko. I am one half of the JCCO team for the Department of Corrections in Somerset. Kind of knock on wood, status quo right now. Not going to jinx myself too badly there. But things are going, you know, fairly status quo without any major issues, which is always a good thing. I'm unfortunately still working to try and find intensive residential placements out of state for high needs kids on my caseload. Thankfully, one kid after about a 6-month wait did get placed just this past week out of state in New Hampshire. And I'm hopefully going to find a placement. It's looking like maybe Georgia or Tennessee for the other youth that has significant needs. So that just continues to forever be an ongoing issue, unfortunately, to find placements for these kids with pretty significant mental health needs. So that's kind of the scoop locally. As far as Department of Corrections goes, JCCO Troy Varney unfortunately had a very serious snowmobile accident over the weekend. He will be out for the foreseeable future, and we're sending thoughts and prayers for his recovery. He's in the hospital right now. But his Hancock County cases will be covered by JCCO John Bennick out of Ellsworth. His Waldo County cases will be covered by JCCO Dan Delahanty out of the Belfast office. So in case anybody has any connections up there and they need to know who to call, those would be the two officers. And you can reach out to me if you need direct contact information for them. I'm happy to provide it to anybody that needs it. So that's kind of the scoop from DOC. So that probably wraps us up unless anybody has anything that they want to add. And the awkward silence. So I will say it seems like this was a good opportunity for us to record. So we'll see how it goes, getting it up on Facebook and see if that works for folks that weren't able to make it. And we'll kind of play it by ear next month to see if this is something we want to keep doing. So thanks everyone for showing up and hanging out with us. And we will see you again in March. All right, take care.
Bye, everyone.
Bye.